classrooms, these B1 or 2, they all surround the healthcare simulation lab, so they tend to be more healthcare classes, nursing classes.
What do we look for when we're enrolling for radiography?
It's a separate application. The healthcare programs tend to be the ones on campus that have separate applications.
Okay.
Students first apply to the general college. That's open enrollment. They take their prereqs, their gen eds, their chemistry, anatomy, phys, whatever's required. But then to actually be enrolled in radiography or nursing or medical assistant, they do need to fill out an application because they are competitive processes. They're typically due the spring before, anywhere from February to April, prior to that fall. All that information is out on our website. They use very objective point systems, so then they'll have that very clearly outlined on the web. Some of it's based on the classes you've taken, the grades you've gotten, the T's or the nurse entrance test, all kinds of factors. But again, very objective point system, okay?
Radiography will accept 16 students per year. And so that's probably one of the most competitive on campus as well.
Nursing, competitive. We have everything right now from your basic 5 or 6 week certified nursing assistant, which is kind of the bottom rung. We have medical assistant now, which is a 1-year program that is really kind of a combination between LPN level nursing and some of the like medical business and office filing, computer systems, that kind of thing. Mm-hmm. Oftentimes they are going to be the people that do like the rooming in clinics. Okay. We have the 1-year LPN. LPNs primarily work in nursing home and clinic settings. And then you can do your 2-year RN or all the way through a 4-year bachelor through the main program, the Minnesota Alliance of Nursing Education, all here in Austin. RNs are hospital nurses. A lot of Mayo and a lot of them are now requiring bachelors, which is why we are offering that. If you want to work at, let's say, St. Mary's or Methodist or one of like the Mayo affiliated, and you want to work in the high-level adrenaline areas, cardiac ICU, ICUs, ERs, you're going to need that 4-year.
Sure.
Makes very good money. Nursing probably has one of the greatest placement rates of any field right now. There are not enough trained nurses. All you have to do is look at the want ads. So, high demand jobs. This is our healthcare simulation lab, made to look, feel, smell just like a real hospital. This is now probably getting close to 10 years old. One of the most state-of-the-art training facilities around. It was funded through a combination of a multi-million-dollar Department of Labor grant we got, and then Austin, Outlet, and Owatonna hospitals and healthcare systems also donated a lot of money and equipment, okay?
Gotcha.
These are simulators. They are robotic, computerized human beings. When these are up and running and the computer's going, they talk, they cry, they cough, they can throw up. If you have them up and going and you have a stethoscope, well, first of all, you'll see their chest going up and down, you'll see their mouths moving. You can listen and get heart sounds, lung sounds, bowel sounds. You can start IVs from them. Okay. You can draw blood from them. And there are several now that deliver babies. They live or die based on the care that you give them. From the initial, did you diagnose the problem correctly? Did you treat it correctly? Did you give them the correct medication? Did you give them the correct dosage of medication? Computer, believe it or not, reads all that. You'll see the cameras. They film a lot of this. They can either actually live stream it to the outline classroom so other students can watch and see what's going on. They can also play them back for students. So, for example, I was one years ago where the patient died and the student was just, they'll cry sometimes because it's so realistic. But she was absolutely insistent that she did everything right. And when they replayed it, I mean, it'll actually zoom into, they zoomed into the syringe, and the student gave, she diagnosed it correctly, went through all the proper kind of procedures, gave them the right medication. It was like morphine, but she gave them a lethal dose. And when you zoomed in enough, you could see that.
Gotcha.
One-way glass. On the other side is a computer and an operator that's kind of running the whole thing. You will see that they are realistic to the point of having blanket warmers, IV warmers. They do neonatal, so you've got everything from delivering of babies and brand new babies to they do death passages. So they actually have to do like hospice settings as well that they train in. They have this right here like any other regular hospital, and our health unit coordinator students will come over, medical administrative assistants who are based in FLE, but they will come over and we're doing full-blown simulations and participate, okay?
Okay.
Again, everything from small children to, you name it. They can change them out with wigs, and that's Jane McKinley, and she is our, she's an RM, but she's also an expert in what's called melange, which is like literally a professional makeup artist.
Okay.
She can make them so realistically look like they have a broken bone, putting it like protruding, bruising, burns, gunshots, you name it. It's crazy how real it is.
Okay.
You look over there and you'll see there's actually simulated like limbs. That's so you can learn to do things like get pulses, start IVs again, give injections, and the computer again will tell you if you're heating the vein and if you're doing it correctly. It's crazy, the simulation, just crazy. This area is in large part where our medical assistants and phlebotomy students train. We have a one-year phlebotomy certificate, blood drawers, lab type people. Very good jobs in that, short-term training. This oftentimes is where they have the hospice, the end of life scenarios. Okay. Here's where they learn to like draw blood and start IVs, because this is the arm and the computer will tell you if you're hitting the vein. How crazy is that, huh?
Pretty cool.
Look at even here starting at chest.
Pick lines.
Yep. So the technology is just unbelievable. The babes, they're very real to life.
I do believe this is the mannequin that will deliver. You can always tell because she will have... Oh, this isn't her. Must be this one.
Yep. And when they deliver that, you'll actually get a baby. They'll come out in the uterus. It's just craziness.
That's really cool.
It is really cool. So, this is really kind of a shining star, and even if people aren't interested in nursing, I love showing in this area because I think it's a really great example of the kind of technology we offer.
Mm-hmm.
It surprises people.